All right, ladies, how are you guys doing today?
Good.
Good. Feeling a little of the COVID isolation funk, but I think
Right?
we all are. Yeah.
Absolutely. Before we get in too deep, do you ladies want to introduce yourselves?
Sure. My name is Dr. Amy Shouse, and I am the clinic owner of the Northern California Center of Integrative Medicine
Awesome.
here in San Rafael, California.
My name is Rainey Straus, and I'm a health and wellness coach and a healthcare focused designer. And I also work with Amy at the clinic.
And my name is Dr. Sidney Pomin. I'm a chiropractor and owner of TAM Chiropractic. And we all wanted to get on here today because what we're feeling now more than ever with our patients is this desire and in a lot of ways like a new need and a necessity to be able to access this healthcare in a different way. So I know the first thing we wanted to talk about was a study that just came out. Amy, if you want to do a quick overview of that.
Yeah, so there were some NYU doctors and scientists at the NYU Langone Health Center in New York, and they were doing a survey of hospital admissions, and they found that the number one chronic risk factor for hospitalization was obesity. That was after age, advanced age, over 65. But it was, when you discount age, it was the number one chronic risk factor for hospitalization. So basically what that means is if you're overweight or obese, you're more inflamed and you're more likely to be hospitalized. And I kind of wanted to talk really quickly too about the Lancet study, which is a study that was done about 6 weeks ago, where they looked at 2 hospitals in China, and they found a very similar trajectory. All those patients, they were more hypertensive, diabetic, and had cardiovascular disease. But I think all of those things, as we know, kind of weave together. So
is it okay if I hop in? Because part of what I do as a coach, everyday conversation, everyday dialogue for people.
Mm-hmm.
So really, I think what I'm hearing is these studies are basically telling us the healthier we are to begin with, the more we have an ability to fight this disease that is going to be an ongoing risk culturally for us.
Exactly. And I've said before, it's like COVID-19, coronavirus 2 is here to stay. It's not going anywhere. We're going to have to mitigate it, of course. But all it does really is it takes a big highlighter pen over the issues we're already facing collectively as a culture here in America, that people are just not living a healthy lifestyle. Most of us are overweight, and it's a really good opportunity to think about making some changes.
And I think that really speaks to the fact that we are getting to an unprecedented time where, of course, people understand, yes, like if I'm on high blood pressure medicine, that's not the best thing for me. Or if I'm carrying a little extra weight, that's not the best thing for me. But I think the dialogue and what the three of us have in common is we look at this as helping our patients build up resiliency, right? Like you guys said, this isn't about complete avoidance of this virus. Of course, wear your masks, your gloves, wash your hands. We're doing everything we can. But if you look from an epidemiology standpoint, this virus is going to spread. And so how do we build that resiliency within our patients? And what we realize is that the current medical model of it doesn't address the problem until it's a huge problem. The medical model doesn't worry about your blood sugar until you have full-blown diabetes. And what we're saying is that there's an entire window before the diagnosis where we can come in and make a change. And what does that actually look like, right? Like people are overwhelmed and inundated with online classes, with practitioners, with, do-it-yourself checklists that people kind of blow out, right? And we can't blame our patients for getting frustrated and irritated with this system that doesn't actually provide solutions. So that's why, Rainey, if you can talk a little bit more about how you approach it from a health coach standpoint. I know Dr. Amy and I have a practitioner view of how we navigate with our patients, but then there comes that piece of the information and the application that I think you fill in really well.
Yeah, that's a totally great segue. So I think the thing to recognize first off is that this work is done in partnership. It's done in partnership very often with a clinician. Clinician is, handing a patient a whole bunch of recommendations. And in the case of the two of you, the recommendations, hopefully, very often in that window before. So I come in, and really the idea, I think, for all of us is to create more agency and accountability with our patients, so that they own this space and can keep themselves out of that later phase of the health system when they're in dis-ease.
Exactly.
So to do that, there is an entire process. The structure is based on something called motivational interviewing, and that's the way I work. And it's really about helping people get to the what's in it for me from that clinical list of to-dos. Because often it's overwhelming, there's too many things, as you stated earlier. A patient doesn't know where to begin, and it doesn't feel necessarily connected to what's important in their own lives. So the process really takes a step back from the clinical, and I start out in conversation about what's important in a patient's life. What are the things they value? What gets them up in the morning? What are the things they want to be different in their life? Is it that they have so much joint pain that they can't, take their grandchildren out on a walk? Like, we start to investigate the day by day so that they can uncover for themselves those motivations that then connect to the clinical recommendations.
That's beautiful.
Yeah, I absolutely love that, because it's so, I think the shift that we're trying to see, and I know that Amy and I have worked in partnership before, is that it's no longer one patient, one doctor, and then a single solution. I think it's about building a team of support system, of practitioners, of health coaches, of people to help you guide you through this. Because when I'm asking a patient to have to look at the factors that are really affecting their high blood pressure, Rainey, you pointed on this. It's like, well, what's the motivation? It's not that they want to get off high blood pressure medication.
Exactly.
It's finding the motivation of, I want to be able to go and run around with my kids at the park this Sunday, right?
Absolutely.
But our system doesn't set it up like that. So I think all three of us really approach that with our patients, that mindset of hey, what's in it for you guys? What's in it for you to get off your high blood pressure medication? What's in it for you to be able to lose weight, so that before, we already had our collection of reasons. And now, based on the study, especially that Amy summarized, it's these comorbidities then impact our ability to be resilient. So how do we then empower our patients to access that resiliency that they really have?
Exactly. I think it's filling in the gap too, because everybody, on a national, federal, and state level, everyone's talking about hand washing, social distancing, and these measures, but no one's talking about building resilience, building immune resilience, building a lifestyle that can face this virus out there in the world.
It's just a reflection of the current model of medicine.
Exactly.
Yeah.
So I think what our goal collectively as a team is to kind of help fill that gap. I'm really glad that you brought that up, because Sydney, because that's exactly right.
Yeah. And I feel like it's our, for me, and I know that the two of you feel the same way. I feel like it's my responsibility to go out and navigate all of the information and then find the best information for my patient. And I think that mindset shift from a practitioner standpoint is also huge, because I've always resonated with that. My role is also to be a teacher, right? To help navigate it, so you don't have to spend 4 hours going through the research articles and discovering what the comorbidities are of COVID. It's our job to say hey, these are the facts we're extrapolating. These are the tools that we have. And now it's more important than ever for you to design your own team, because I'm going to go a little corny here. It's people deserve this, people deserve to feel healthy. People deserve to have this amazing human body that has so many innate systems involved in it. They deserve to have access to that. So I know that that's a huge motivating factor for me, is to just get people back to what I know is already inside of them.
Yeah, everybody deserves that vitality, that process, that we had spoken about this earlier, but this idea of well-being, like a holistic functioning life that is not just their physical systems, but all the other parts that are intertwined and contribute to that. It's all very interwoven.
And that's
Very
what
much so. Yeah.
I love the work that you do, Rainey, is because you really get to dive in to the personalization of somebody's why. Like, for me, it's like I struggled with my weight pretty much all through my 20s and early 30s. And it wasn't until I actually got support from Dr. Amy and we were able to figure out my why and then give me a system that we could then utilize and execute. And it was just like, whoa, holy crap. Like, I got to make that connection. I got to have a system given to me by a practitioner that had steps to it. And I was able to execute it. And I imagine that, Rainey, that's what you facilitate with people, is that why point. Because I do see that that's a miss with a lot of access that people have right now.
Yeah, it's a combination of the why and the exploration of the how coaching does. But I'd like to talk a little bit about that. But one of the things that I found just really kind of an amazing fact when I started to dive into coaching was this notion, and it's proven out with data, that one of the most effective ways to support behavior change is just to be in relationship with a supportive individual. It could be a clinician, it could be a therapist, it could be a coach, but just the nature of that relationship is incredibly powerful.
I had a physician that I loved in Berkeley like years ago. And she told me the best health outcomes for patients are when they have a really good relationship with their provider or their team. And I believe that 100%. But I kind of wanted to, can I bring up the case study for the case? Like, I just kind of want to throw that out there. So just want to kind of bring up like a scenario, and this is based on a real patient, but she's about in her mid 50s, professional woman, works hard, wants to lose weight, has some joint pain. She's got gut issues. She's clearly inflamed, but her main goal is to lose weight. But she does have some issues where she gets a lot of social pressure from her family and friends to eat like they do. And what she had said to me is, quote unquote, I just want to be like everybody else. And so she feels that pressure socially to not be on a special way of eating. She feels that pressure probably in her relationship at home. And she sort of gets like this resentment and frustration that she can't be like everybody else. So I try to tell her, why would you want to be like everybody else? But, of course, she's a good candidate, or that scenario is a good candidate for health coaching, I believe.
How would you approach that, Rainey?
Yeah. Sorry, I just put myself on mute there for a second.
No worries.
Well, as I started to describe earlier, the first part of the process is very much about looking at general motivations, right? And creating an ideal picture of your life and your health. So that's pretty much always where I would start. But then, there's this particular track that we know we're going to be diving into here. So the way I work is to create a set of goals. But I also like to think of them as experiments. So each week, together with the client, very much in charge, we would design some specific things to try. So in this instance, it could be she goes out with her family. This is a non-COVID scenario, obviously. Right. And, everyone's drinking wine, they're ordering high calorie foods, everything she knows she's not supposed to be eating. But earlier, before we've done this design, we've started to dig into what are her reasons for weight loss. So we can then begin to build off of those reasons and also the strengths that we've identified, which is another tool that I like to work with, as her framework to create these experiments with. So maybe we'll try, so we go out 3 times a week. I like to start people really small. So allowing the client to make the decisions about what she would like to try. Perhaps she would come up with something like, well, maybe one of the nights we go out, I can try not having wine and ordering like a really robust salad for dinner. It's a very small little slice to bite off, but that might be the experiment for the first week. Mm-hmm. Something very doable. And again, you know, the clinical recommendation may be like, well, you know, we need to just switch it all up immediately. But that's not really the way coaching goes, because it is very much about putting the client in the driver's seat. So I can push or I can attempt, but I really have to let them lead. So we'd come back, there'd probably be a series of experiments over a week or two, and then we talk about how they went. And let's say, you know, we had a 2-week gap, and the first week, no problem. The second week, yeah, it didn't work as well. Maybe she didn't order the wine, but she ordered the lasagna.
Right.
So we'd look at each of those instances and kind of unpack them to understand, like, what were the surrounding factors, like the night that she was able to do it, like what was different in her day? Did she get more exercise? Was she less stressed? Then the night that she went out and she was like, oh, the hell with it, I just deserve the lasagna. Like, what was that day about? So then we can start to understand the circle around the behaviors and unpack that a bit and try some new things. So it's not so much about like, were you completely successful, but what did you try and what did you learn? And how can we iterate on that next time so that we start to get closer and closer to something that actually works?
Mm-hmm. Yeah, I love the 2 concepts of experimenting,
Mm-hmm.
and what I think is important too is holding space for the time of this, right? I think culturally we get sold so many quick fixes that if we make those commitments for 3 weeks and we don't see major changes, it's human nature to get disappointed, but really, Rainey, sounds like also just like holding space for people to be able to navigate that icky time, you know, in the transition period where we don't see the results, but we know we're chipping away at it, and to not get discouraged or, you know, lost in the quick fixes that we get sold.
Right. I mean, behavior change is not a quick process.
Nope.
And I think that's one of the things that's of great value with just setting small goals, especially at the beginning, because then you begin to feel the buzz of the success, right? Oh, I was able to do it 2 weeks in a row. Yeah. And then you can build on that. Whereas if you bite off, like, you know, an entire diet change, and you know, sometimes practitioners are like, okay, starting tomorrow, you're going to have to be,
you're going to change your whole life,
dairy-free. It's, you know, it's so, I mean, we all know it's so challenging to flip that switch.
It's not going to happen. Yeah.
Exactly.
So that's awesome. I think we went through a lot, ladies. We've got to go over those studies and look at that case study. And I think really the important takeaway is that we're a resource for people who are ready to make some changes. And I think that this current pandemic, we might find ourselves and people listening might find themselves in a position to be like, you know what, it might be time to dive into this. So I just want to make sure we had some time to go over our contact information. So I'll go first. I am Dr. Sidney Pomin at TAM Chiropractic, which is tamchiropractic.com. We're also on Facebook and on Instagram.
And I'm Dr. Amy Shouse, and it's Northern California Center for Integrative Medicine, and that's norcalintegrativedmedicine.com. And you can also find me on Facebook and Instagram.
And this is Rainey Straus. You can find me with Amy or at Figure 8. That is the word figure, the number 8.studio.
Awesome. Thank you for your time, ladies. I appreciated the talk.
Yeah,
Thank you.
Great. Thanks.
Have a good one.